Hi, my name is Kara, and I'm a registered physiotherapist at Proactive Pelvic Health Center. Today we're going to talk a little bit about pelvic organ prolapse. Pelvic organ prolapse is when any of the pelvic organs, including the urethra, bladder, vagina, uterus, rectum, or small intestine, sit lower than normal due to tissue and muscle weakness. Typically, the organs push on the front or the back wall of the vagina, causing the vaginal walls to collapse inward. A prolapse is named based on which organ is involved. So let's go through the three most common types. First, a cystocele or prolapsed bladder is when the bladder collapses into the front wall of the vagina. This can result in incomplete emptying of the bladder, which can increase one's potential of developing bladder infections. A rectocele or prolapsed bladder is when the bowel collapses into the back of the vaginal wall. This can result in the stool getting stuck in a pocket of bowels during attempted evacuation, which may cause incomplete emptying of the bowels. And last, a uterine prolapse is when the cervix and the uterus collapse into the vagina. In this case, you might be able to feel the tip of the cervix at the vaginal opening, which can feel sort of like the tip of your nose. Risk factors for the development of prolapse are numerous and can include things such as chronic constipation, increasing age, the bearing of children, excess body weight, genetics, a chronic cough, or long-term heavy lifting. Common symptoms one might experience in the case of pelvic organ prolapse include heaviness or pressure felt in the genital or pelvic region, incomplete emptying of the bladder or bowels, or bulging at the vaginal or rectal openings that can be seen or felt and that may change depending on position or activity. For example, symptoms may worsen with coughing, lifting, straining with a bowel movement by the end of the day, or with prolonged sitting, standing, or walking. First line of treatment for pelvic organ prolapse includes physiotherapy treatment. So if you happen to experience any symptoms of pelvic organ prolapse, book in to see your doctor or your pelvic floor physiotherapist today.